Heart problems, brain damage, debilitating fatigue and breathlessness. They're just some of the long-term health problems post-COVID. Tonight, how Australians are struggling to cope after being struck down by the virus.
Completely devastating. It's changed my life so much.
I used to climb mountains, I used to do lots of things, so it's very different to how I've always done life.
27,000 cases in Australia, 57 million worldwide.
I can't watch TV or read, and my memory's gone.
As the numbers grow, so too the long-term health concerns.
It's everything from blood clots, seizures.
A pattern emerging overseas, now echoed here. Previously healthy people simply not recovering from COVID.
You know, I've said to a few people that this Kerry Lee that you're talking to now is essentially born in April when I woke up from the coma. I'm a totally different person.
It's been dubbed long COVID. While some get lucky, others don't.
It most certainly is a thing. We are now appreciating that there is a proportion of patients who experience long-term symptoms after they've had COVID-19.
When COVID first hit, we were led to believe catch it and you'd end up here and possibly never leave. While that's a sad reality for some, it's the unexpected twist to this virus that only now is causing medical alarm.
And I'm very grateful to be alive.
Mum Bridget was on the ill-fated Ruby Princess cruise with family. Her life changed the moment she stepped off.
They put me in an induced coma for 14 days. When I came out of the coma, I had a pacemaker put in because of my heart. I also lost the use of my legs from the waist down and my arms, and it impaired my speech.
And it only got worse.
Completely devastating. It's changed my life so much, and my sisters in Sydney and their husbands, and of course my mum passed away from it. It's hard.
40 days in hospital and now 8 months on, she says there's been little improvement. The 59-year-old's infection-free, but some symptoms remain.
And it's so new that they don't know what the long-term outcome's going to be.
Some of the first Australians to test positive are now warning all is not well with them.
Well, I get annoyed, I get frustrated. That's why I've agreed to speak on this show, just to say to people it is serious, and please just have your distance, wear your mask and wash your hands and do all the things that we know are helping.
Health worker Kim Hurley described herself as an Energizer bunny prior to contracting coronavirus. Now the 60-year-old says she struggles with debilitating fatigue and breathlessness 230 days on.
And it wasn't until as the weeks dragged on that I started to realise actually this is a little bit more than just recovering from a flu as people talk about it. It is a lot more serious than that.
Doctors now finding the long-term effects of the virus are just as mysterious. A health survey found 35% of COVID-19 sufferers did not return to their usual state of health 2 to 3 weeks after testing. Among those aged 18 to 34 with no chronic medical conditions, 1 in 5 had long-term problems.
People with long COVID experience anything from just prolonged periods of fatigue to prolonged respiratory illness where they sort of really still struggle to catch their breath after going up a flight of stairs. Sometimes there's neurological complications, and there is really an emerging body of evidence that it can cause cardiovascular or problems with your heart.
Doctors, such as Queensland's Kirsty Short, are leading research teams to uncover what a COVID infection could mean years down the track.
Already there's been evidence emerging that women are a bit more susceptible than men, but we want to get down more into the details of it. Can we define which particular patient cohorts are at risk of this long COVID?
Heart problems, brain damage, DNA scrambling. Researchers even looking into a link to Parkinson's disease. Kiri Lee Ryder is a virus volunteer. She fears health complications could be costly long after COVID.
The fact that doctors are starting to catalogue and recognise that long COVID is a thing is great. You know, hopefully they can do something about these side effects, but at least that acknowledgement that long COVID does exist is a starting point.